Welcome to Understand Hip Osteoarthritis. I'm Jack March, the Rheumatology Physio, and in partnership with Cetra Health, we are going to explore the condition hip osteoarthritis, its causes, risk factors, symptoms, diagnosis, treatment, and outlook. This video forms part of a series that covers lots of different conditions, from hip osteoarthritis to rheumatoid arthritis. You can find all of these on this YouTube channel and at cetrahealth.com, which also has downloadable information sheets on all of the conditions covered and a lot more. Please leave questions on the video. I read and reply to all of them. But for now, welcome to Understand Hip Osteoarthritis. Osteoarthritis is a condition that causes joints to become painful and stiff. It can affect any joint, including one or both of the hips. Although the changes to the joint itself cannot be reversed, there are effective treatment options available to help manage and reduce your symptoms, improving your quality of life and the function of the hip joint. In this picture, you can see the pelvis and then the ball and socket joint of the hip. You can see bone spurs and thin cartilage, and this is a hallmark feature of hip osteoarthritis. Causes and risk factors. The hip joint is a ball and socket joint where the rounded end of the thigh bone, the femur, fits into the socket of the pelvic bone. A strong, flexible tissue called cartilage lies in between these bones and acts as a cushion so they can glide smoothly past each other without rubbing. In a joint with osteoarthritis, the cartilage is thinned and loses its smooth surface. Areas of increased pressure can grow outwards as an attempted protection, and these are known as bone spurs. Many factors can either slow down the replacement of the cartilage or reduce the quality of the replacement. These include age, genetics, obesity, repetitive stress, common with heavy manual occupations such as building or farming, hip dysplasia, when the hip socket does not completely cover the ball portion of the thigh bone, joint injury or trauma, and medical conditions like rheumatoid arthritis. Symptoms. Osteoarthritis in the hip can cause a range of different symptoms which varies from person to person. You may experience mild pain and stiffness, or more severe and continuous symptoms which make it difficult to sleep and carry out everyday activities. Common symptoms include pain, stiffness, limited range of motion, clicking, clunking or popping, and weakness. The pain is often worse with activity such as lifting, carrying heavy objects, or after exercising. There can also be aching at rest or at night, and the pain may extend down the thigh or into the buttock. Both hips can be affected at the same time. Diagnosis. Initially, a healthcare professional will assess your condition by asking you questions about your symptoms, including the nature of your pain and any triggers like a recent injury. They will then examine your hips and assess your range of motion. An X-ray or MRI may be performed to assess the joint and rule out other causes of the symptoms. Sometimes there are a lot of changes in the hip, and sometimes there are none. There is no specific blood test to diagnose osteoarthritis. Treatments. Treatment options include specific exercises. These will help to improve the function, the strength and range of motion of the hips. General fitness exercises such as walking, swimming and cycling. Weight loss. Maintaining a healthy weight is important to reduce the pressure on the hips. Anti-inflammatory creams. Assisted devices such as walking aids or braces. If osteoarthritis causes severe symptoms, such as significant disruption to sleeping or walking, surgery can be an effective option. This is called joint replacement surgery and involves removing the joint and replacing it with an artificial joint made of metal and plastic. By utilising a range of treatments and maintaining a healthy lifestyle, many people with osteoarthritis remain active, managing their symptoms and avoid the need for joint replacement surgery. Outlook. Hip osteoarthritis is a chronic condition, and medical professionals are currently unable to improve the changes that occur to the joint itself. However, if treated early, the symptoms can improve significantly and even resolve despite the altered structure of the joint. Joint replacement surgery is not inevitable, and many people return to excellent hip function using a regular exercise program. Always speak to your healthcare professional if you have any questions or concerns. And that's a wrap for this part of the series, Understand Hip Osteoarthritis. I'm Jack March, the Rheumatology Physio, and thank you to my partners at Cetra Health for providing the visuals for this video. You can find information on lots more conditions right here on this YouTube channel, and for more in-depth information and downloadable resources, head over to cetrahealth.com. Have any questions or thoughts about what we've covered, any conditions you want me to cover, any questions about other videos, then please drop them in the comments below. I make it a point to read and respond to every single one. Until next time, thank you for joining me on this journey to understand hip osteoarthritis. Stay curious, stay informed, and most importantly, stay healthy.